The World Health Organization on March 11, 2020, declared COVID-19 a global pandemic. While the COVID-19 pandemic posed a significant challenge to the world and to Africa, it also presented an opportunity to rethink, shift, and reset. One of these visionary partnerships was quietly working to change the healthcare landscape of the continent.
We formed a partnership with the Africa CDC, and it is based on 4 pillars. First, to purchase vaccines for 65 million people. Second, to roll out vaccinations across the continent to millions and millions more. Third, to lay the groundwork to build that workforce for vaccine manufacturing on the continent. And fourth, importantly, to invest and strengthen the Africa CDC.
The Saving Lives and Livelihoods initiative, set up to urgently procure COVID-19 vaccines and ensure their prompt distribution to millions across Africa.
The Save Life and Livelihood supported African people to avoid the consequence of COVID. And we know that Africa was well protected. We thank colleagues from Mastercard Foundation for their support, but also to build the resilient system we are talking about.
The initiative was also dedicated to empowering healthcare institutions, rapidly expanding vaccine administration with the ambitious target of achieving 70% coverage and establishing local vaccine manufacturing capabilities within the continent. This bold $1.5 billion partnership was focused on saving lives and safeguarding livelihoods in Africa. Recognizing that a well-trained, motivated health workforce is the cornerstone of an effective healthcare system, the program launched comprehensive training programs. From aspiring nurses and doctors to laboratory technicians and community health workers, these future healthcare heroes were equipped with the knowledge and skills they needed to make a difference. By August 2023, more than 38,000 health workers had been trained and deployed, leading to the creation of over 23,000 job opportunities, with a focus on 25% for youth and 55% for women. This has greatly advanced the ability to provide healthcare at the community level. As the initiative unfolded, the impact was visible in hospitals, clinics, and remote rural communities.
Our countries initially didn't have this Africa CDC bringing them together, but we are getting there because we have strong support from our head of state, from our member state ministers and others.
The program's impact spread across at least 25 African countries, and Africa CDC's capacity was fortified, including the integration of 106 new staff, bolstering the continent's ability to respond effectively to other health crises.
There can be no global health security without regional health security. Public health is fundamentally tied to resilient economies.
The Africa CDC, through the Saving Lives and Livelihoods initiative, empowered the health workforce, leading to a significant enhancement of primary healthcare systems.